This is Dr. Lytle from the Laser Learning Center. Today's lesson is on back and hip pain. Back pain, next to headache, causes the most missed days of work in the United States and causes a great deal of complications from drugs and medicines used to control that pain. Your Q1000 laser will work on back pain, and I'm also going to show you some extremely beneficial exercises to do in conjunction with applying the laser. Turn your Q1000 laser onto mode 1 and apply it to proprioceptive points as demonstrated on page 6 and 7 and 8 of your low-level laser user's manual. Leave it on each of these points for approximately 6 to 8 breaths or 45 seconds to 1 minute each. They'd be in this location, and then underneath of the black in this location, so that you're right underneath the collarbone, and then with the black off in this location, right on the scapula. Once you have done that, I'm going to now get on the floor and show you how to use an extremely important, simple device that you can get for free. The equipment that you need for the rest of this exercise is a tennis ball, and you can go to any bicycle store and get a bicycle racing inner tube. Usually they're free. These are the equipment. You use them in this way. Using the tennis ball, place it under the hip so that you can put some weight on it and roll in this fashion so that you feel the tennis ball releasing the tight muscles in your hip. You may have to brace your hip with the other hand and take some of the weight off of the hip, because this will be extremely sore to some of you. If you apply the laser first, it will reduce a great deal of the soreness. Be sure to use the tennis ball on the side of the hip where the hip extensor muscles are. This is important because these are the ones that will cause the hip joint pain. Use the tennis ball for 3 to 4 minutes, rolling around on it on each hip. Then taking a pillow, such as I have here, a firm pillow like this is best. Place it under your buttocks in this fashion. Take the bicycle inner tube, hook it over your neck, and then hook it over a foot. You may put your hands in it in this fashion so that you have some control over it. Then, using tension on the inner tube, you may move in all directions. You can move this way, clear over to the floor, or you can move this way, clear over to the floor. Without the use of this inner tube to support your leg, the muscles will tighten up and will not allow you to go to this far extension. So you basically are allowed to rotate a hip in a fashion that is very difficult to do without the inner tube. Be innovative. Use your hands to put pressure on it in certain positions. You can also use it as a bicycling movement, such as this. Do this every other day. If you do it every day, you might find it a bit sore. If both hips are bothersome, you may insert it over the other hip, such as we've done here, and you can get it over one shoulder, and now you're ready to do the other hip. You may, again, do it in a bicycling motion, such as this, or stretch it clear out like I'm doing here, and then raise it up. In the old athletic days, we called this heavy legs. And if you have bad hips, you probably can't do this without the use of this bicycle inner tube. Now, if you have it clear over to this direction here, and this hip is extremely sore, here you may apply mode 1 of your laser while you're in a stretched position, right to this part that feels stretched, and apply it for a minute or 2 to those muscles that are tight in the buttocks or the hip. Following this protocol, I believe that you'll be able to avoid hip replacement. Thank you.